If you are having a procedure below the waist, you may be able to avoid a general anesthesia by having your operation under spinal or epidural anesthesia instead. Spinal and epidural anesthesia are also often used during childbirth. Both spinal and epidural anesthesia involve injecting medications near the spinal cord. This makes you numb from the level of your chest down to your feet. Advantages include the ability to be awake during the procedure and to avoid the risks associated with general anesthesia. To begin with, the healthcare team will attach some monitors to check your blood pressure, heart rate, and blood oxygen levels. Other monitors may also be required depending on your individual circumstances. These monitors will provide important information about your health during and after the procedure too. Spinal and epidural anesthesia can rarely cause the blood pressure to fall and other changes that might require rapid treatment. For that reason, you'll have an intravenous line in place so that fluids or medicines can be administered quickly. The anesthesiologist will insert an IV into a vein. It's usually in the back of your hand, but could be elsewhere depending upon your individual circumstances. An IV is a small plastic tube that sits in the vein and can be used to give medication and fluids. Inserting the IV may hurt a little as a needle is required to get it through the skin and into the vein. It's usually over in just a few seconds. The anesthesiologist will use an antiseptic solution to clean the area of your back where the medicine is injected. To decrease pain from the needle stick, he or she may install a local anesthetic directly over the spot where the spinal or epidural needle will be inserted. You may feel this small needle for a few seconds. Spinal anesthesia involves a single injection of medication into the sac of fluid that surrounds your spinal nerves. To reach this fluid sac, the anesthesiologist will pass a needle through your skin, between the spinal bones, and finally through spinal ligaments and the dura, which is the protective membrane around your spinal cord and nerves. Spinal anesthesia begins working almost immediately after the injection is completed. With epidural anesthesia, the needle does not penetrate the dura and medication is deposited just outside of the sac of fluid that surrounds your spinal nerves. Epidural anesthesia may be given in a single dose, or the anesthesiologist may leave a tiny flexible tube or catheter in place in the event more anesthesia is required for longer procedures. Epidural anesthesia takes about 10 minutes to begin working. The anesthesiologist will test if you can feel anything below your waist. Once safe, the procedure will start. You'll be awake during the procedure, but you won't be able to feel anything from the waist down. The anesthesiologist will monitor you throughout and may give fluids and other drugs, such as painkillers, anti-sickness medications, or antibiotics through the IV. After the procedure is finished, you'll be taken to the recovery room. The nurses there will make sure you're comfortable before you go back to the ward. You may be kept flat in bed for several hours. Only once the effects have worn off completely will you be able to get up with assistance. The contents of this video are a general depiction of this type of anesthesia. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.